Hello, my name is Liesl Nadia. Welcome to Eloquent Health and Wellness. Today we are going to discuss intermittent vacuum therapy as part of a multidisciplinary approach towards wound care and sports rehabilitation. In our center, we use the Vacuumit system specifically for wound care as well as sports injuries in promoting faster wound healing. How does the system work? Well, firstly, we need to start at the beginning. Why was this developed and why are we using it today? The Vacuumit was developed by German and NASA Space Technology for the use of astronauts in space. And luckily, we can now use it here on Earth. The great reason behind this is the fact that it promotes blood flow. Now, as you know, if there's no flow, there's no go. The focus of this treatment is to enhance blood flow, to promote venous flow return, as well as lymphatic drainage. Those three components are the pillars in the treatment plan we use this for. To tell you a little bit more about this therapy, I would like to introduce you to what we presented last year at the UMA conference in Amsterdam. At our center, together with my colleagues, we did a study on 82 patients. The aim of the study was to evaluate the impact of intermittent vacuum therapy as an adjunctive therapy in the treatment of complicated wounds and sports injuries within an advanced wound management center. In the study, we had 82 patients, and our patients were selected with the following criteria. If the wounds were delayed or slowed with slow wound healing for more than 2 months, the etiology in the methodology included diabetic wounds, vascular insufficiency, neuropathy, trauma, post-surgery, and also ligament tears 1 to 3 degrees. If we look at our treatment protocol, the treatment protocol followed the normal pathway. We used the wound care according to the wound bed preparation guideline. We also used the recommended intermittent vacuum therapy or IVT programs according to the device manufacturer. These sessions normally contained a session of 30 minutes each, and the patient received anything from 4 to 10 sessions depending on what the etiology was. The study group contained of 33 patients with diabetic foot ulcers, 31 patients with vascular ulcers, 4 patients with lymphedema, and 4 patients with post-operative wounds that had slow healing. We also had 10 athletes with ligament tears included in the study. Now, to give you an example of a wound care treatment including the Vacuumit device. Now, I would like to give you an example of a wound care treatment that included the Vacuumit therapy as part of the treatment protocol. As you can see on the screen, this patient had severe rheumatoid arthritis. He also underwent reconstructive surgery of the foot. What you will see in the first picture is a dehiscence in the wound care. We've got open instrumentation, inflammation and infection in the foot. And at that point in time, the patient was worried that they're going to lose their foot. We started immediately with Vacuumit therapy, and he received 1 session every day for 5 days subsequently. We also did standard wound care according to the wound bed preparation guideline, and as you can see from the photographs depicted in the slide, this patient really did extremely well on the therapy. There were no amputation done, there were no instrumentation removed, and he went on to heal completely within 2 months without any further complications. Other results I would like to share with you that were very interesting to us are 4 different cases. The first case on the screen you will see was a patient that was bitten by a dog and subsequently underwent reconstructive surgery where they did only a skin graft on the exposed tissue. Unfortunately, this failed, and this resulted in severe lymphedema as well as venolymphedema. The patient also developed infection and she lost a lot of the skin graft. We started with wound healing but also added intermittent vacuum therapy, and as you can see, within 1 month we achieved complete closure of the wound without any additional surgery. The second patient had trauma to his lower arm, fractures his ulnar and radius. He received surgery in hospital, stayed in hospital for quite a while, but also then developed compartment syndrome. The surgeon didn't wait for the swelling to go down, but opted to have a skin graft over the exposed granulation tissue, which resulted in quite a large lesion and very poor healing. We started with intermittent vacuum therapy to decrease the edema and also to minimize the scarring and to promote healing. And as you can see, we received excellent results according to this clip. And he only had 6 sessions. The third case is a patient with venolymphedema. Now, this patient has been struggling for more than 2 years with severe swollen legs. And as you can see from the pictures, he only had 5 sessions within 10 days and we decreased the bilateral lymphedema with 4 centimeters on each leg, a total in the end of more than 12 centimeters. The fourth case is a very interesting case. This patient had osteosarcoma and subsequently had a leg amputated. She still has her hip in place, but suffered from poor wound healing as well as lymphedema. The struggle here was to prevent further drainage from the wound site and to promote healing. And as you can see, this patient struggled with a lot of issues. The patient struggled with not only patient-centered concerns such as pain, but poor body image due to the amputation. It was also the ongoing struggle if the cancer was to be healed or not, or do she need to go subsequent further surgeries. As you can see from the photograph, within 4 sessions, in less than a week, we managed to decrease the edema significantly, enabling her to be more mobile and also enabling better healing. I've now mostly focused on wound care and intermittent vacuum therapy, but I also would like to talk to you about ligament tears and vacuum therapy. In sports injuries, one of our biggest problems is the fact that patients need to rehabilitate as soon as possible to get them back on the field to play hockey or to run or whatever it is that they are doing. Now, in our centre, what we've seen so many times over and over and again, where it normally takes a ligament tear 4 to 6 weeks to heal, we can actually get those patients back within 2 to 3 weeks, active on the field, busy with the rehabilitation therapy. Especially when we look at first and second degree ligament tears. These patients really do well in the therapy, and I will show you some examples of what we see before and after. Most oftenly with sports injuries or acute injuries, we see that 4 to 6 sessions are more than enough. What we also see is that patients tend to come back. Athletes use the technology as part of their training program, and it's an ongoing relationship at the centre to make sure that these athletes perform at their best. In sport, we have a lot of questions as to how can we get the athlete to heal faster? If you have good blood flow, you have good oxygen. And please understand that this is not hyperbaric oxygen therapy, but it enhances blood flow and therefore also your oxygen levels. Not only does it do that, it also helps with venous return. So it stimulates the venous valves to work better. It stimulates blood flow, getting back to your liver and your kidneys, and the best of all, lymphatic drainage. As you know from a sports injury, you will have swelling, you will have bruising, and a lot of pain. Now, how do we get rid of that swelling? Normally, we would use ice, we would use heat. But in this case, if you add intermittent vacuum therapy, you can decrease the swelling immediately. We've had cases in this machine where a patient pre and post, after the session of 30 minutes, will already show a decrease in centimeters, more than 1 centimeter, wherever the injury is. The pain factor is also very important for us in athletes. If you can decrease the pain, you get a patient to heal better, and you get a patient quickly back on the field again. So for us here at Eloquent Health and Wellness, not only did this technology make a difference for us in wound healing, but it's definitely making a difference for us in rehabilitation. If you have a patient that struggles post-operatively with knee surgery, have difficulty getting back on their feet, struggling with swelling and edema post-surgery, this is certainly something that you need to think about. We are seeing a decrease in swelling, getting patients back on their feet much sooner, and as well, if you include this in the treatment regime before they go to theatre, you will also have a better result. In conclusion, number 1, it is not hyperbaric oxygen therapy and can therefore not be discussed as oxygen therapy on its own. Secondly, it's not negative wound pressure therapy, where we use a small device directly on the wound itself to facilitate wound healing with suctioning and negative pressure. Thirdly, this is intermittent vacuum therapy developed by NASA and German Space Technology to promote blood flow, to promote venous return and lymphatic drainage. It is used in healing of sports injuries, wounds, post-operatively and pre-operatively as well. I'm very excited about this technology and so glad to be sharing this with you. If you've ever thought of promoting blood flow, venous return and lymphatic drainage, this is the technology that would work for you as well. I cannot think about my practice without having this tool to help us with advanced wound care. And this is the one thing that makes our treatment here very unique. We encourage patients to come and visit our clinic, to come and experience it for yourself, and to tell other people of what you experience through the technology. You know what I really like about the technology? It does what it says it does. It promotes blood flow, the key to healing, the key to healthy living as well. And if you can get that for patients, they will heal. Here at Eloquent Health and Wellness, we focus on making a difference in patients' life. And I will never forget the one patient who came back the next day to tell me, I've slept for the first time in months after I have received this therapy. If we can decrease pain, we can improve the quality of living in patients. If we can promote blood flow and take care of lymphatic drainage, we can save limbs and we can prevent amputations. At Eloquent Health and Wellness, we are passionate about our patients and we want to make a difference. And we have found advanced technology that enables us to do just that. I hope you found this informative, and I really hope that this will make a difference to your life as well when you use this technology. You are more than welcome to contact us at Eloquent Health and Wellness. You can just visit our website at www.eloquent.co.za and just click on the right links for more information.